Hey Vanessa, I'm Jill. I'll be your nurse practitioner today. What brings you in today?
Well, my stomach's been hurting.
Your stomach's been hurting?
Yeah.
What's it feel like?
Well, it just cramping a lot, and I've had diarrhea a little bit.
Okay. And been going on for
3 or 4 days.
3 or 4 days?
Yeah.
And anything make it better, worse?
No, not really.
What would you rate it?
Well,
So
about a
you're
3.
3?
Yeah.
Any fever?
No.
No? Nausea, vomiting?
Just that diarrhea.
Okay. Well, since you're here, I'm going to listen to your lungs. I'm going to inspect your lungs. I'm going to look at your heart. I'm going to look at your stomach, your abdomen, and I'm going to do a neurological exam and a musculoskeletal exam, okay?
Okay.
And I'm going to start with the lungs. I'm just going to look at your chest. I'm just going to look for symmetry. I'm looking for any abnormal bony prominences. I'm looking for any discoloration. Looks good. Nice and symmetric. You having any pain when I touch?
No.
Not feeling any crevitus. Ticklish.
No.
Okay. Alright. Now I'm just going to look for chest expansion. Placing my hands on your back. They're warm enough? You warm?
Yes.
Okay, take a deep breath for me. Good. Nice even expansion. Good. Okay, now I'm just going to kind of percuss on your lung fields, okay? And listen
Okay.
for resonance. Listen on each side. Don't hear any hyperresonance, any dullness. Okay, and now I'm just going to listen, okay?
Okay.
I'm going to listen to all your lung fields. Deep breath. In and out. Good. 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 Lungs are clear bilaterally. Laterally. When I look at your chest, I'm not seeing any barrel chest. Your AP diameter is about half as much as your lateral. I'm just going to kind of poke on your back to see if you have any tenderness. Did that hurt?
No.
Okay, good. No shortness of breath or anything? No cough?
No.
Okay. Alright, now I'm testing for egophony. Say E.
E.
Okay, sounds like ah.
E.
Good. Okay, now whisper the brown dog run through the field.
Brown dog run through the field. Brown dog run through the field.
Okay. Didn't hear it. Didn't radiate through her lungs. It's an overall normal lung exam. Okay, now I'm going for the cardiac exam. I'm just going to look at the chest wall again, and I'm looking for any pulsation. Sternum's nice and flat, clavicles are nice and symmetrical and even. I'm not seeing any pulsations, any discolorations. No tenderness, so we assess for that in the lung.
No.
And I'm just going to listen to your heart, okay?
Okay.
I'm going to listen over the pulmonic arch and the aortic arch. I'm listening for S1 and S2 and any extra sounds. I'm going to listen with the diaphragm or the bell or the diaphragm first. No extra heart sounds. Nice and strong and regular. Listen for the apical pulse. 1 minute. Pulse is 64, nice and regular. I'm seeing the carotid pulse in the neck and at the sternal notch. Now I'm just going to palpate your carotid one at a time. Nice and strong, no stenosis. And I'm going to listen the bail of the stethoscope for any bruise. No bruise. Sorry. Good. Sounds good. No bruise. I heard no gallops, no murmurs during the heart auscultation. And now I'm just going to assess pulses, radial pulses. Nice and strong, grade about 3. And then I'm going to assess the femoral pulse on each side. Nice and strong, about 3. Bilaterally. Now I'm going to assess the popliteal pulses. Bilaterally. Good. 3 on those also. And for dorsalis pedis. Also 3, bilaterally, and posterior tibial. Good pulses, 3. Now I'm assessing for any kind of edema, posterior tibial edema. Don't feel any edema. Good capillary feel. Fingers. Extremities are nice and pink, warm. Capillary feel less than 3 seconds. And that concludes the cardiac exam. Okay, this is the abdomen assessment. And first I'm going to inspect the abdomen. I'm looking at contour. I'm sorry, I'm going to have to raise your gown. And I'm just looking at the contour of the abdomen, maintaining privacy, making sure the patient's warm, and looking for any obvious pulsations, any asymmetry with breathing or asymmetry period, looking for any masses, any pulsations, peristalsis, which you can't see, also looking for any discolorations. The abdomen looks nice and convex. I don't see any pulsations, I don't see any discolorations. I'm going to listen to the abdomen. I'm going to listen in all 4 quadrants, and I'm also going to listen for bruits for the iliac, renal, and the aortic arteries. I'm going to start in the right upper quadrant. Medium pitched. No high pitched sounds. No absent vowel sounds. Medium pitched. Medium pitched. Right lower quadrant. Medium pitched. Okay, the aorta lies left to the midline, so I'm just going to listen with the bell for any bruits. Don't hear any bruits. Renal. Arteries. No bruise. Iliac. Umbilicus is nice and midline. Normally I would have the patient completely unclothed, except for underwear, of course. No bruise. Okay, now I'm just going to percuss for tenderness and listen for tympany. Good. And now I'm going to percuss for the liver borders, okay? I'm going to start down here until I hit a dull spot. go mark it. Okay. I'm going to percuss down. Liver borders. And the normal is 6 to 12 centimeters. Looks like she's about 7. So no enlargement noted of the liver. And I'm just going to kind of feel your abdomen. Are you having any tenderness when I do that?
Mm-mm.
None at all?
No.
Good. Okay, and now I'm going to palpate a little deeper, okay? I'm just
Okay.
feeling for any organ enlargement. I'm going to feel for the kidney. Okay, take a deep breath for me. Good. Feel any kidney enlargement there? Deep breath. Okay, now I'm going to perform for the Murphy sign. I'm going to hook my fingers up under your ribs and you take a deep breath. Don't feel the liver. Did that hurt?
Mm-mm.
And this don't hurt? Rebound tenderness?
No.
Okay.
No.
Okay, I'm going to ask you to lift your leg against pressure on my hand, okay? And lift your leg up and push against my hand. Does that hurt?
Mm-mm.
Okay. That's the C.O.N sign. It's negative. Okay. Good. Okay. Now I'm going to perform an obturator test to see if you're having any tenderness. Does that hurt?
Mm-mm.
Okay. Good. Okay, now I'm just going to palpate the inguinal lymph nodes for any enlargement. Under your pants, sorry.
It's okay.
No enlargement noted. And that concludes the abdominal exam. Okay, now I'm going to perform the musculoskeletal exam. I'm going to have you stand up for me. I'm going to inspect, first of all, the range of motion of the neck. I'm going to have you turn your head from side to side for me. Okay, and look up and chin to chest. No pain?
No.
Okay. And now I'm going to look at your spine. I'm just palpating for any kind of bony prominences, any kind of deviation, any kind of tenderness or warmth. Don't feel any. Feels nice and midline. And I'm going to have you bend forward for me. Palpate the spine. Nice and midline. No scoliosis, no kyphosis, no lordosis. Any pain with that?
No.
Okie dokie. All right. I'll have you sit down for me. Okay, I'm looking at the musculature. Muscle tone's appropriate. No atrophy noted. I don't see any kind of deviations in the joints, any kind of swelling, bony prominences, warmth on the chromium process, olecranon, metacarpals, I'm sorry. And then as far as the knees go, don't feel any extrasynovial fluid, no warmth, no bony prominences, no tenderness. As far as the ankles, no synovial fluid, extrasynovial fluid, no warmth, no tenderness. Okay, all right, I'm gonna have you externally rotate your shoulders for me. I'm going to palpate while you're doing that. Okay, now internally rotate. Back like this, yeah. Good. I don't feel any kind of deviations in movement. Do you have any pain with that?
No.
Okay, I'm going to ask you to hold your arms straight out for me. I'm going to ask you to flex and extend. No tenderness there.
No.
Okay, in your wrist, I'm going to ask you to deviate radially and ulnarly. Okay, and flex and extend. Okay, and abduct and adduct. Good. Okay. And then your fingers, I'm gonna ask you to extend and flex. Okay. And then abduct in, and then adduct to get the strength. Good. Good. Squeeze me. Okay. And then hold your arms out for me. I'm gonna push down, push against me. Good. Good. Muscle tone's good. All right. I want to ask you to extend your knees, and then flex. Flex your knees for me. You can flex them. Bend them. Bend your knees.
I'm sorry. I didn't know what you was talking
Okay.
about.
In your ankle, I'm going to ask you to dorsiflex, up, and then plantar flex. Good. Oh. Dorsiflex, plantar flex. Okay. No crepitus, no warmth, no tenderness in any joints. Okay, I'm going to have you lay down for me. And I'm going to ask you to adduct your hip and then abduct your hip. Move it out for me. Any pain with that?
Mm-mm.
I'm not feeling any kind of deviation in the joint, any kind of popping or cracking, crepitus. No tenderness, right?
No.
Okay, I'm going to abduct and then adduct. No tenderness, no
No.
crepitus in the hip. Okay. And now I'm going to perform the McMurray sign. Okay, I'm going to bend your knee. Okay. And I'm going to move your foot in. Does that hurt?
Mm-mm.
Okay, and out.
No.
No? Okay. Bend your foot toward me. And then I'm going to push it out. That doesn't hurt.
Mm-mm.
Okay. And now I'm going to perform the drawer sign. I'm going to bend your knee. And I'm just going to pull. Does that hurt?
Mm-mm.
Okay. Okay, good. All right, you sit up. Overall normal musculoskeletal exam. I felt no warmth, no tenderness. There was no crepitus, no kind of extra bony prominences or anything in the joints. That concludes the musculoskeletal. Okay, now I'm going to perform the neurological exam. First of all, I'm going to have her stand. And I'm going to have her walk across the room. I'm just going to look at her gait. I'm looking for any kind of imbalance. I'm looking for any kind of abnormal movements, tremors, anything like that. You just want to walk across the room for me. Nice and symmetrical gait. No imbalance, no lack of coordination. Okay, I'll have you sit back up here for me. I'm sorry.
It's okay.
Okay, now I'm going to test for strength. Okay. I've done this in the musculoskeletal, but I'm going to do it again. Hold your arms out for me. Okay, push up. Okay, squeeze. Okay, push down. Good. Okay, push toward my hand. Good. Good. Push on my hands. Good. Okay, and then push on toward my hand. Push down on my hand. Good. And then push up on my hand. Good. Down. And then up. Good. All right, and then your hands, I want you to pull your hold your fingers out against resistance. Good. And then push out against my resistance on your fingers, like that. Good. Awesome. All right, and then squeeze. We done did that. Okay. Now I'm going to measure the deep tendon reflexes. I'm going to start with the biceps reflex. Just hold your arm, relax it out like that for me. Finding the tendon. Okay, and I'm just going to strike this, okay? You might feel a little twitch. Good. +2 in the left. +2 in the right. Okay, now I'm going to do the triceps. And just relax for me. Okay, +2. Good, +2. Now I'm going to do the patellar reflex. Here we go. Okay, +2. Good. I'm going to do the Achilles. +2 there. No hyperplexia noted, no flaccidity, no atrophy, no rigidity in the muscles. I'm going to need you to stand up for me again. I'm sorry.
It's okay.
And I'm gonna just have you stand straight with your eyes closed. I'm looking for any kind of imbalance. This is the Romberg test. Good, nice and balanced. And now, one more time, I'm gonna have you, I should have done this while you're standing, I'm sorry. I'm gonna have you sit back up here and I'm gonna do a sensation test on your legs, okay?
Okay.
I'm just gonna measure for, your sensation to see if you can distinguish between light touch, painful stimuli,
Okay.
soft stimuli, okay? And I'm gonna have you close your eyes, and I want you to tell me if you feel a sharp or if you feel a soft.
Sharp.
Good,
Soft.
good,
Sharp.
good,
Soft.
good,
Sharp.
good,
Sharp. Sharp.
good,
Soft.
good,
Sharp.
good,
Soft. Soft.
good.
Sharp. Sharp.
Good. You're able to distinguish between the two. Okay, also for part of your neurological exam, I'm gonna have to have you stand up and I'm gonna test the strength of your lower extremities. I'm gonna have you perform a shallow knee bend. I'm gonna have you stand on one leg and I'm gonna ask you to kind of squat. Okay, and then do the other. Okay, and then I'm gonna ask you to stand on your tiptoes for me and then stand on your heels. Good. Okay, good job. Concludes that. Good job. Nice normal neurological exam.
Okay.
And that concludes the neurological exam.